Originally, from April 1st, all employees in the British NHS health service should have been at least twice vaccinated. Otherwise, they would have been fired. But suddenly the government is planning to withdraw compulsory vaccination for a pragmatic reason. The planned compulsory vaccination for staff in the English National Health Service NHS is on the brink. The law passed in December was the right strategy at the time, Health Minister Sajid Javid said in Parliament. But the facts have changed since then. As such, today I am announcing a hearing to end vaccination as a requirement for healthcare and nursing employment, Javid said. If the results of the consultation confirm the move, the law will be repealed. While a general obligation to vaccinate against the coronavirus remains the exception internationally, numerous states have opted for strict regulations for medical professions and nursing. In Germany, vaccination will be compulsory in the healthcare system from March 15th. But the advances are controversial, especially since medicine and nursing are already struggling with significant staff shortages in many places. Vaccination remains the best defense against COVID-19, emphasized Javid. Just last week, the Health Secretary warned NHS workers that they had a professional obligation to get vaccinated. But I think it's no longer proportionate to make vaccination a condition of employment by law. Javid gave two reasons for the new situation. The first is that our society as a whole is now better protected against hospitalization because of COVID-19. The higher risk of infection from Omicron means that at the height of the most recent rash at the turn of the year, every 15th person was ill with COVID-19. In addition, the course of disease with the Omicron variant is less severe than with earlier variants. The bottom line is that both points mean that the protection of the population is significantly better today than it was just a few weeks ago. The NHS was due to be vaccinated by April 1st, by which time 2 doses should have been given. Because of the time distance rules, this would be the last opportunity for an initial vaccination next Thursday. The compulsory vaccination was only planned in England. Northern Ireland, Scotland and Wales regulate their health policies independently. So far, no regulations for medical professions have been passed there. The obligation to protect by vaccination is not new to the NHS. For example, hepatitis B vaccination is mandatory for many employees. To date, around 77,000 NHS workers have not received any vaccination. Not all of them have direct contact with patients, so they would not necessarily be affected. In the worst case, however, strict enforcement of compulsory vaccination could mean that around 5% of employees in hospitals and practices could no longer be employed in their current role with patient contact or would have to go. Vaccination skepticism is most pronounced in nursing and midwives, according to the industry. Individual regions would be even more affected. In London, almost 9% of the NHS are completely unvaccinated, although I personally don't understand that. Professional associations welcomed the new move. They would urge all colleagues to get vaccinated, said Patricia Marc, director of the Royal College of Nursing. But in the current situation, the risk of losing additional staff would not make sense. Already today, 100,000 vacancies in the NHS cannot be filled. Welcome to Brexit. The hearing should also review the vaccination requirement that already applies to employees in geriatric care, said Javid. The rule for double vaccination has been enforced there since November 11th. Since the announcement in the summer, the willingness to vaccinate had increased significantly. Around 40,000 employees were still unvaccinated as of the reporting date. Not all of them had to go, however, given medical exception rules. The NHS received the announcement with, let's say, mixed feelings. They are frustrated that such a fundamental change in policy has come at the last minute, said the heads of the NHS Confederation and NHS providers, 2 umbrella organizations for health services, in a joint statement. This applies all the more in view of the great efforts that have been made in recent weeks to be able to meet the deadline. They could understand the government's reasoning, said Matthew Taylor and Chris Hobson, but they have serious concerns about the overall message about the importance of vaccination after this U-turn. And Prime Minister Boris Johnson, meanwhile, never misses an opportunity to highlight the country's vaccination successes. In fact, only 71% of the population is fully vaccinated. The German comparison value is 73%, and that's still too low. COVID restrictions from the obligation to wear masks to proof of vaccinations for major events have been practically completely lifted in Great Britain since last week. The recommendation to work from home, if possible, no longer applies since January 20th. However, the number of infections remains stubbornly high. The current 7-day incidence is 1,036, with 1,838 deaths in the past week. In many companies, the high number of cases continues to lead to significant impairments. The schools are throwing a spotlight on this. Last week, 415,000 students in state schools missed classes due to COVID-19, which corresponds to 5.1%. Among teachers, absenteeism was even higher at 9%. And I'll see you in my next video. Bis gleich.